Hey, Unc.
Yes, yeah.
I'm Banok. I'm one of the blackfellow nurses that's going to be looking after you today.
Thank you.
All right.
Yeah, yeah.
Why did I become a nurse? I didn't know what I wanted to do. But then I thought, maybe I know that I want to do something in the health field because I've seen so much illness and sickness in my family that I wanted to help change that, in my communities. My father comes from a family of about 12 or 13 children. Every single one of them has diabetes. How long have you been getting dialysis treatments for?
I've been nearly 7 years.
7 years, yeah? How did you get chronic kidney disease?
Yeah.
Yeah?
It started off because of diabetes.
Okay.
Yeah.
Yep.
Yeah.
They define health as being, social, emotional and physical. But for us, for Aboriginal and Torres Strait Islander people, we define it as social, physical, mental and spiritual. Where we get that spiritual well-being and that spiritual wellness is, being connected to family, being connected to culture, being connected to your land or being with your communities. That's where we get our strength from. That's where we get our spiritual strength from, especially being back on country. And so to not having that and not being around that, but also with everything that has happened in the past and all the families that have been affected by it, it does definitely affect your spiritual health. Most of the time going to a hospital is a last resort. Some people might feel shame for being Aboriginal, so being embarrassed, being shy. Sometimes you might feel shame to ask questions because you're like, I don't want to ask that because then they're going to think, this Aboriginal person doesn't know this, this and this, because she might not know the answer to that because, she's Aboriginal or this, and you just feel shame. Do you still get scared of hospitals coming in?
Well, I'm starting to get used to it now.
Yeah.
Being old.
Yeah.
Shouldn't be scary.
We talk and we yarn I like to do it for at least a good 10 to 15 minutes. When was the last time they went home? Where their family is? Is there anyone coming in from their family to see them who I know from their family? Just those little connections that we like to establish, and the way we greet each other is we aunt, uncle, sister, brother, you hug them, or some people you don't hug, you just know not to hug them. But that's just how we greet each other, and that's how we establish a connection. Create an environment where they feel like they're with family and that they're not alone. So I chose to work in St Vincent's Hospital because compared to my other experiences, being on placement as a university student, I dealt with a lot of racism. So for me, when I came to St Vincent's and I was on placement here, I got in contact with the Aboriginal Health team here, and they were very supportive, and they gave me Aboriginal mentors that could look after me and look out for me. Just the environment that they've created for Aboriginal people here is very inviting, and it's a very safe space.